Okay, this week we're going to get into social responsibility. So, we have a lot of gifts and skills that we've been given through our dental hygiene program, and it's kind of talking about why and what are we supposed to do with that to give back to society. Here's your learning outcomes, and here's a quote. If you haven't got any charity in your heart, you have the worst kind of heart trouble. Don't you just love these? Anyways, there is, I don't know if you've heard this in your other classes, but there is a new Surgeon General's report on oral health. So remember how we had the one in 2000, and I think even when you guys were in my classes last year, I kept saying, they're supposed to have a new one, it's 2020, there was supposed to be a new one released in 2020. Well, I think the pandemic basically got in the way, and they were able to say it was released in 2021. It was like December 21st, 2021. So they got it just barely before 2021. But anyways, the exciting thing is that it's updated and it has a lot of information that is applicable to what is going on right now. We're going to really get into the Surgeon General's report during class. But I will say this, I like the way that it's organized because it's organized by different populations as far as age groups. So it starts with child and adolescent and then elderly, kind of moves through. And it identifies what problems are existing in those different populations. So that is exciting. Here's some major findings of it, but like I said, I'm going to kind of skip through this. The other thing that I really like about it is it has action statements. So it's having little ways to try to get us to act to help improve the oral health. Give me a specific item I can do to help it get better. And a lot of that is involving like access to care. How are we getting access to care and things like that. Now, the other video that you're going to watch talks about those who helped develop it, and it kind of talks about some of these things in more detail as well. Let's see where it happened on my mouse. There we go. Okay, there is another report that's called the National Institute of Health Report on Oral Health Disparities. And the thing that they identified is that a lot of the racial minorities are the ones that are found to have oral health disparities. And they also said that by 2050, the minorities will outnumber white people. The other thing about that, I think it's on my next slide. Yeah, it says more than 47 million in the United States are underinsured or without health insurance. I was just looking at the new oral surgeon report, and it said that dental health insurance is 2.5 times worse than health insurance, meaning 2.5 times as many people don't have it than just health insurance. So it's specifically, even when people are able to get things for their physical ailments or whatever, we know that the mouth is a window to the body and all the oral systemic links. That's mostly what I wanted to say here. So, if you think about kind of what our code of ethics is, we talked last week about justice and, the whole making sure that everybody is treated equally. So it is part of our code of ethics to make sure that everyone does have access to care that needs it. These are some terms that you're going to hear kind of related to this. Caring is involved with caring for other people. So, feeling the desire and need to help others who maybe don't have as much. Stewardship is taking care of something or, kind of taking the reins on something to help move it forward. And then justice, we talked about this as far as making sure that everyone is treated equally. So, a lot of the ethic values and principles that we talked about might focus more on the individual, like autonomy or self-determination. Those are kind of for this specific individual, but these kind of words are focusing more on the general population. As far as social justice, this is really, think about some of those terms that we've learned lately. Justice means that everyone is being treated equally. So whether you have insurance or not, you still have access to care. Whether you live in a nursing home, you still have access to care, right? And along with that is the, what was I trying to think of? I can't think. So anyways, ADEA kind of came up with these different ways to help improve the oral health status. And one of them is to kind of, determine what are the future oral health care workforce needs. So if we think about that, now we start thinking about that mid-level provider, the dental hygiene practitioner. That's when we're looking at future oral health care workforce needs. That's what we're kind of looking at. Improve the effectiveness or the oral health care delivery system. Just recently, we started with teledentistry, and teledentistry is a way to reach some of these, rural areas or nursing home areas and still be able to provide care without having to have them travel long distances. Prepare students to provide oral health services with diverse populations. Dallas College is one of the reasons that Dallas College picked up our program, we used to be Stanford Brown, was because they wanted us to be able to provide for, the Dallas County population, a lot of which are lower income. And so that is one way that you students are giving back. And then improve the effectiveness of the allied dental professionals in reaching the underserved. So now we're going to kind of talk about specific ways you guys can help alleviate dental disparities. Provide dental hygienes at a safety net clinic. So I'm assuming a safety net clinic is somebody like that's getting out of abused relationship, a shelter type thing. We're always talking about trying to get water fluoridation. And when you look at the Texas map, surprisingly, there is, a lot of areas that don't have fluoride in the water. Participate in state organized caries prevention programs. So this might be fluorides for children, sealants, things like that. Work with local dental groups to address oral health disparities. We talk about school-based fluoride and sealant programs. Volunteer at dental and general health fairs. Sometimes they'll have them specifically for elderly, so you might be able to do screenings or talk to them about dentures or, whatever. Provide dental hygiene services in mobile dental vans. I have a friend that does this. She goes down to, she drives the van around and she actually goes to nursing homes and is able to treat elderly. Support collaborations among community-based programs and practitioners. So correlating with the Texas Oral Health Coalition or whatever else. Educate patients regarding the importance of public programs and dental health. Once you get other people involved besides dental people, then they can reach out to their legislators as well. Educate local, state, and federal policymakers, help them be aware of the situation, and become involved in discussions regarding public health infrastructure. Support research on oral and health disparities. So you guys are going to be, if you aren't already, in community talking about, doing studies and research. And a lot of the studies that you guys have had to do for your literature reviews, they will be studies about this. We talked to these pregnant women and taught them about this, and this is, so that's all kind of part of this research part of it. So then we know, oh, this did work with pregnant women. So we should start implementing this program other places or with school children or whatever population. Recruit individuals to join the oral health care workforce. Keep informed on care delivery systems, reimbursement schedules, changes in public policy. Advocate for improved funding and access for Medicaid recipients. And advocate for better dental insurance and the inclusion of dental benefits in any new national health insurance plans. This is an interesting map because this is the most current in 2021, talking about those that have that mid-level provider or something along that line. All the purple ones already have a mid-level provider, and then the pink ones are actually trying to legislate for something to pass right now. And so you can see we're kind of in this, southeastern area. We're not moving very quickly. Then again, some of us are just trying to get local anesthesia, but there's that. But anyways, certainly that mid-level provider is trying to fill that gap of these people who do not have access to care. And that's one way, that's one of the reasons it's getting passed about in all these things. Legislators, they don't care whether we have a mid, level provider, but they recognize that it's filling a gap that is, happens in a lot of areas within the oral healthcare setting. Okay, the test of our progress is not whether we add more to the abundance of those who have much. It is whether we provide enough for those who have little. So I'm going to go ahead and stop right there. This is your only PowerPoint from me, but you do have the other video talking about the new oral surgeon report. And, there's a little bit of kind of talking at the first. You can maybe skip to minute 3 or 4 or something like that, where they really get going. Anyways, I'll see you in class. Bye.